Hello, this is Dr. Gay from First Look MRI, and this is a 17-year-old male who is an athlete. They have back pain, kind of chronic back pain, and this is an example of a stress fracture. And these are not terribly uncommon, and they're usually in younger people who do really strenuous things like rowers or sometimes football players, people who do gymnastics. And so this is the vertebral column here, looking from the side. Here's the front of the vertebral column. Here's the back of the vertebral column. We see these little horizontal bands, or the discs, to get oriented. See the vertebral bodies of the squares in between. And if we roll to the right or left side, we see these things in the back called the posterior elements. So back here is a spinous process, kind of like on a dinosaur. You see these things poking off the back here. This is the spinous process here, here, here. And if we roll to the edges of the spinous processes, we see facet joints. So there's a facet, here's a spinous process, here's a facet on the other side. Now right beneath the facet, there's a bone that comes off that's called the pedicle. And right here is a pedicle of L5, this is the L5 vertebral body. And right here, there's a little bit of brightness. This is a very, very subtle finding on this patient. But there's a little vertical band of darkness. That's a little stress fracture. And the stuff adjacent to it, this white, is surrounding fluid in the bone. We call that marrow edema. So this patient had a stress fracture of the left pedicle. And this will just heal itself fine if you limit the activity. But if they keep pushing it, it can go on to have a displaced fracture that can fracture and separate. So it's really important to find these and have them limit their activity so it doesn't go on to that. So this is a view that's more sensitive for marrow changes. This is L5 again. We're going to roll to the right-hand side and see this pedicle here. And this thing coming down is a part of the facet joint. The bottom of it makes the connection with this facet. And the top of this goes up here and connects to this facet. But right in between here is the pedicle that comes off the vertebral body. So this is a normal pedicle. It comes right off. Nice normal signal. But if we jump to the other side, we see this white. See how white this is? Again, that's fluid in the bone related to that little stress fracture. So again, a really subtle finding. This is a nice normal one here. We have one other sequence that shows this maybe better than anything. And this is called a stir sequence. And marrow changes, anything in the bone that's abnormal shows up as bright. So if we look here, say right and left pedicle looking normal. If we go to this level, right, good, left, see how bright that is? So this is that left L5 stress fracture. And that's it. So thank you so much.